What's going on, everyone? Happy Wednesday. Hopefully, everyone is doing well, staying safe, healthy, having a great day so far, and I really hope you're testing negative for all those viruses. It is time now for the Wednesday edition of the Virus Update for Wednesday, September 24th, 2025. If you're new to my channel, welcome to my channel. This is where I do the daily virus update on all those viruses that can make us sick. There's a lot of viruses out there, and you need to be informed of what's going on. I give you the latest news, data, information, wastewater. Yes, we can track viruses in wastewater. It's actually really neat to do that. If you want to stay informed, just subscribe to my channel down below. If you like today's video, give it a thumbs up. Let's try for 150 like button hits today. Of course, share this video with anyone you know, and leave your comments down below. Also, if you want to support the channel, ways to do that are listed down below. Alright, we do have several news stories today. We also have some data from New York State, which last I saw is encouraging. We'll have to see. Today's update is very late today, but yesterday's was very encouraging. Plus, we're going to randomly take a look at some wastewater sites at the end of this video. Starting off with Illinois, the health department recommends COVID vaccines for all adults. So, Illinois now joins the growing list of states that are saying all adults should be able to get the vaccine when it comes to COVID. And remember, you know what our stance is here on the channel. You do whatever you feel is in the best interest for you. I am not forcing you to get a vaccine. I am just telling you the information that is available to you. Alright, this is not good. We start off with good news. Now we got to go to some bad news. This is coming from Sci-Fi. New California. Yes, this is brand new. California reports all regions have high levels of SARS-2 in wastewater samples. 6 out of 68 sites show increasing trend. 57 out of 68 are decreasing. So the good news is the majority are decreasing. However, they are still dealing with high wastewater levels there, which is not a good thing to see. But the good news with this is that it is starting to drop in some regions. The problem is the backside of a wave still has just as many cases as the front side of the wave, depending on how long it takes for it to go down. And at this rate, you can see here, if we look at this chart right here, we can see things are definitely on a downward trend. So that is good. And once they get to this yellow level, which they got a little ways to go, but once they get there, things will be down into what they call the medium category. Taking a look at Virginia. Hey, Virginia still has some work to do. In fact, Virginia is still listed as high levels of COVID, and you can still see here, there is a lot of maroon places still, which means very high levels in some places, even up near D.C. 1 in 30 estimated to be actively infectious at this time, according to PMC. So, yeah, that's not good. And in D.C. area, Washington, D.C., it's actually 1 in 28. As noted here, you can see here, there's some very high wastewater sites there at this time. All right, speaking of wastewater, let's go across the ocean, shall we? Let's take a look at Ireland. I did find the wastewater for Ireland. This is a little bit behind. It's a little over a week ago, but we can see here that in Ireland at this time, we do see some up arrows going on, where things are increasing in some regions. We also do see, we see quite a few of them, but we also do see some of these boxes, which indicate, hey, things are flat at this time. So, yes, COVID is still an issue there. COVID has been an issue all across Europe. It's something we are continuing to follow. Measles. That's been a real issue in a lot of places around the world this year. And in the Americas, measles cases up 31-fold in the Americas region this year. The Pan America Health Organization, PAHO, in its latest measles update late last week said countries in America's regions have reported, get this, 11,313 cases so far this year, 23 of them fatal in 10 countries. The number represents a 31-fold increase compared to last year at this time, when 358 cases had been reported in the Americas by mid-September. That's a significant increase. Almost 96% of the cases of measles and deaths have been recorded in Canada, Mexico, United States as well. And then additional cases have been reported in a bunch of other countries at this time. So, yeah, measles is still a problem. Over 71% of confirmed cases were unvaccinated. Think about that. 71% of them are unvaccinated. And someone's probably getting ready to say, oh, it's the vaccinated that's getting you measles. No, 71% are unvaccinated. Did not take the vaccine. So, yeah, there you go. Hey, to the older generation, back in your day, the measles vaccine worked. We got a hold on measles, and now there's people that are saying, I don't want my child to get it, and, well, look what's happening here. Oh boy, yep. Speaking of measles, we do have another problem in the United States. 3 new measles cases in Georgia, all linked to Fulton County residents. Yeah, that's not good. So 3 cases connected to a similar person. We're not going to read this full story. I am going to make a post today with all the news stories used in this update. Also, anything that needs to go into one of my tracking threads will do so. All right, moving on to this. In Ohio, Health Department confirms 2025 human case of West Nile virus in Hamilton County, and that is in the Cincinnati area, in case you did not know. So, yes, a West Nile virus case there. Hey, we've been reporting about a few each week, and I think that's going to continue until the weather finally cools off across the United States. All right, let's take a look at this. Over in Poland, bird flu hits 2 poultry farms in the northern region. Yes, we've been seeing an increase in bird flu popping up, not just in Poland, in many different countries, including right here in the United States. I don't have it queued up here, do I? There was supposed to be another bird flu story for you, and that bird flu story is, I could get it for you. I'm not going to. That bird flu story is coming out of Iowa, where, yes, more H5N1 is showing up there as well, or at least I believe it was Iowa. You know what? Let's just go back and get that news story, shall we? That way we are giving you the correct information. Here it is. Iowa is reconfirming a bird flu among Canadian geese. So, yeah, that's not a good thing whatsoever to see bird flu going up. As you know, and we'll just go to that next, as you know, birds are in migration from north to south right now, and here's what the migration looks like here in the United States. Yes, we go into the hundreds of millions yet again last night. In fact, look at that. Wow. Over 800 million birds migrated from north to south last night. That is an insane number. And you can see Iowa right there was really the hot spot last night. And that's just at one given moment there was 800 million. So really the total number for the last 24 hours, likely over 1 billion birds have migrated to the south. Wow, that is a lot of birds. Alrighty, here's the tracking threads. If you don't know what my site is, it is datareport.info. And right on the top category, you do see tracking threads. That's where we're pretty much tracking a whole bunch of things. Measles, sports-related illnesses, school illnesses, and I was alerted to another school illness outbreak of hand, foot, and mouth disease. Can't remember where that was. I'll try and get that on here for tomorrow's video. But yeah, we can see we track a whole bunch of things, and let me tell you, this year's not done yet. We're about to be coming into virus soup in the next few months, so yeah, things are really going to be picking up soon. Taking a look at what's going on in Canada, where we are not seeing virus soup yet. If this does update, if it doesn't, the last update we saw was COVID-19 is moderate, flu A is low, flu B is low, and RSV is listed at low in Canada. They may be in the process of updating this as we speak. So we'll see if we can get anything from there tomorrow. Taking a look at what's going on with air qualities in the U.S. While we do that, let's pause and take a hydration break, shall we? Water is the drink of choice today. You can see there is some yellow, even a little orange and red in the mid-Atlantic, northeast, and some of the southeast, but more so yellow than anything else. Washington and Oregon in the Pacific Northwest, yes, you're still dealing with purple and maroon. Things are not going well for you. Wildfires are the reason for this. I hope the pattern will turn wetter there soon. There have been some indications. Of course, there are indications right now. But as a matter of fact, it is happening right now, where the east is a little wetter, but you really need rain in the Pacific Northwest to do anything about this wildfire issue. Luckily, here in the east, we are getting it because there are some drought conditions, and that should keep the fire risk down here, but the fire risk is not over in the Pacific Northwest yet, at least not until some significant rain comes. All right, let's go back to the southeast again. We've got to talk about Florida for a moment. Something's going on here. I don't know. You peaked for COVID in Florida. Pinellas County. Look at all these sick person calls earlier. I believe there were like 10 at once. Let's see, is that still the case now? It was just 15 minutes ago. Okay, it's not, but yeah, I've been seeing a lot of sick person calls in Pinellas County, Florida. Once again, I don't know, is flu starting to come into play early? I do know you're one of the earlier states that gets going. I just don't know what that's all about. Obviously, some call dashboards, that's the miscellaneous call, but still, to see sick person listed a lot is not a good thing. All right, Philadelphia on Tuesday had 838 EMS calls. Let's do a live look in at what's going on just outside of Philadelphia. We do see 14 calls right now in Montgomery County, only one for respiratory emergency, and in Chester County, what's going on there? We do see respiratory difficulty not once, not twice, but 3 times, and we also do see sick person listed twice, so that is not a good thing. Taking a look at what's going on with the hospital situation in Pennsylvania, and we do need to refresh this, we do see a few more hospitals are listed today. 3 in southeast Pennsylvania, a few in the Lehigh Valley, 1 in between, 1 in the Poconos, 1 to the west of there, so there are some people that need to use the hospital, and in some cases it is resulting in some overcrowding. All right, New Jersey has a problem today. Inspira Center Mannington has a specialty issue. Jefferson Washington Township Hospital, full and total divert at the emergency department at this time. Penn Medicine Princeton Medical, psychiatric issue. That's kind of common there. They don't have a lot of psychiatric beds at that hospital from what I understand. RWJBH Robert Wood Johnson University Hospital is dealing with an emergency department issue. And is that saying divert? Yep, adult divert at this time. And we can see that divert is going to go on for, several hours. So that's 4 hospitals today in New Jersey that are dealing with problems. But now let's take a look at New York State, where we do have some good news. First off, look at the trend line. Trend line is trending downward now. Remember before it was trending downward and that would correct and go upward? Well, here's the good news. Look at cases. Positive cases, 587. That's lower than any point from last week. Also, let's take a look at what's going on with hospitalizations. Hoping this is updated. No, it has not. Neither of those have updated. We can see the hospitalizations in New York State, while they really stayed flat yesterday. That's a good thing because, as you know, I've said this many times over the years that we've done this channel. Tuesday, if they're in a rise, the biggest rise is on Tuesday. And really, it was just a very minor rise for the hospitalizations. Number of people in the ICU, however, did go up to 53. That went up quite a bit. So their death wave is probably going to continue. But I don't know. I'm encouraged here. Could this be New York State now peaking? It is very well possible. We should know maybe by the end of the week or early next week at the very latest. Is this their peak? I'm hopeful that this is the peak for New York State. All right, let's take a look at a wastewater site in each region of the United States. Of course, we know Wastewater Scan still has the entire country listed at high for COVID, but it is coming down. I'm convinced. I think we're going to see this switch to medium in at least one of the regions soon. Maybe that'll be the South region where it does that first. We are watching norovirus. It did go up a little bit and then it flattened out, so we'll have to see what happens with that. Let's start off in the Northeast, shall we? Let's go over to Bridgewater, New Jersey, and see what's happening there. That was dropping for COVID, and still is. It's still listed at high. Eventually, that will drop to medium. RSV, Influenza A, Influenza B, HMPV, EVD6-8, all low and not really much of an issue at this time. Let's go down to the south. We'll pick a wastewater site here. How about we go over to Alabama? How about we go over to, let's see, Fultondale, Alabama, and see what's going on there. Fultondale at this time is seeing that COVID has dropped and is in the low level, and all the other viruses are not really an issue. Aside from norovirus, though still low, is starting to go upward ever so slightly at this time. Let's go to the north now and see what's going on. How about we check on Traverse City, Michigan? I'm seeing that listed at high for COVID once again. As you know, this wastewater site has been very problematic all summer with various different viruses. COVID is high, and That's rising once again, so that's not good. Norovirus is medium. That's starting to rise once again. Hepatitis A, there was a detection at the beginning of the month. And look at this, there are some detections of measles at this time. So multiple viruses giving us trouble there. Although the measles detection, you have to go back pretty far to that. You have to go back several weeks now. I think it was back in August was the last time that we saw a detection there. Let's take a look at Sacramento, California, shall we? Let's see what's going on there. COVID is listed high, and to my surprise, yikes, COVID is still rising at this particular wastewater site. That's relatively interesting. We also see here that there were some measles detections, but you got to go all the way back to June for those detections. Let's continue on here. We just did the 4 regions of the United States, but let's go to the places that are not connected to the lower 48, such as Hawaii. And we see Hawaii here, medium for COVID and continuing to drop at this time. Medium for norovirus and dropping at this time. That's some good news. And we will check up on Alaska while we're at it as well. Let's go up here. As you know, Alaska, or at least Anchorage, Alaska, has been dealing with a flu issue with influenza A. COVID, high and remaining high. Influenza A, look at that. Some indications it may be starting to rise once again. Yikes, that is not good. Alrighty, folks, that does it for today's virus update. If you enjoyed today's update, give it a thumbs up. Subscribe down below. Hit that notification bell. Share this video with anyone you know. And, of course, leave your comments down below. We will have another update again tomorrow, which will include the UK, Ohio. If it's in, New York State's been updating late. If we do get New York State tomorrow, we should have the data from New York City. We really need to see, has New York State peaked? If they had, that is some really good news. But as you see here, there are still a few places here and there that have wastewater sites that are rising. Michigan, obviously, is one of them with Traverse City, at least that wastewater site, Sacramento, California. So while statewide levels are peaking in the majority of states, you still have localized areas that are a problem, and that's something we need to be aware of, and you need to keep an eye on what's going on in your local community. Oftentimes people say, well, the national trend. Okay, the national trend doesn't tell you what you need to be doing in Chicago, Illinois. The national trend doesn't tell you, well, the national trend's doing this, and I guess I'm safe here to do that doctor's appointment in San Francisco. No. Don't look at the national trend to see what's going on in San Francisco. Go over to a site like Wastewater Scan, which is what we did right here. Go down to your wastewater site. There's 2 of them there. We'll do it right now. Bonus coverage. And see what's going on. Wastewater currently says, well, it's still high. It's dropped some, so your levels are still risky. Well, maybe you live in the other part of San Francisco, more to the east. Well, that one says levels are down to medium, dropping a little bit. And as you know, both of these levels, or at least more so the medium level, is different from the national level. National level's listed high, this one's medium, so maybe in the medium site, give it a little more thought. Maybe I should do that doctor's appointment. Get what I'm saying? Alrighty, folks, I will see you again tomorrow. Until I see you again tomorrow, stay safe, everyone, and have a fantastic Wednesday afternoon. Thanks for watching.